Okay, to get this started, I suppose more will come. First of all, I'm Vicky Kolovo and Yannis Rizopoulos. This is the first time we organized it, so I do ask for your patience and your support even for next year. We're really happy that we managed to gather so many startups. Honestly, I'm in the startup world since I was the only woman in Open Coffee when there was only 50 people in there, and I never knew there were so many, and I'm really happy that I can see this happening. So, as you all know, it's 2 minutes. The reason we pressured you is you got to understand 25 startups is really hard for people to just keep on listening. So in 2 minutes, you should be able to convey your idea. It's like a two-story elevator, and I've had harder times when somebody's told me to pitch in one sentence. And this is abroad, so you've got to be ready for this. So we'll start with Nancy Karanasio. And Saki, are you here for the timer, please?
Saki will be the timekeeper.
Yes. And I'll try to
strictly 2
get
minutes.
this
Sakis.
right. So, I'll go on your left, you go on your right.
Thank you.
Just press the start. Press this, yeah. Once you decide.
Hi, I'm Nancy Karanasio from Vidavo, and today I will explain you what we can do with our product, Vidami.
Spacebar. Hopefully.
She has a video for that.
Yeah. No. Just press the spacebar. Sorry. Seems the operation didn't start well.
Technical problem.
Don't worry.
Wellness, medical app, empowering people and motivating behavioral change. The burden of cardiovascular, cancers, chronic respiratory diseases and diabetes is rapidly increasing worldwide and is expected to increase to 57% by 2020. We can reduce the risk by changing our dietary behavior and our habits. Good nutrition is our first defense against diseases and our source of energy to live and be active. More than 100 countries worldwide have developed food-based dietary guidelines that are adapted to their nutrition situation, food availability, culinary cultures and eating habits. In addition, countries publish food guides, often in the form of food pyramids and food plates, educate us how to eat right. Our solution, Vidami, combines scientific methods, guidelines and behavior change techniques all in one application. The idea behind this useful personalized application is that combines an evolved interactive algorithm that adapts your preferences and your country origin with the aim to promote healthy habits. Have you ever thought, if you could you be at risk for disease and not know it? With Vidami you could learn how to eat healthy, without counting calories. Monitoring your vital signs and your anthropometric data, via wearable monitoring devices. Also, you could do an exercise assessment for checking your activity status and all these from your mobile phone. Vidami can help you to set personalized goals and change your habits. Try today the Vidami and discover the new you.
Okay.
Thank you. I'm on time.
You are on time. Really on time. So, the next one will be Mr. Dupis, Yannis Dupis, from D-Partner.
Just give me a second. I've got to start learning how to use this with a second screen behind my back. Yep, manage that. Just use the right arrow.
Change the...
Yep.
the whole 3 slides that I have. Okay, thank you very much for this opportunity to pitch for our app. It took us like 4 or 5 years to develop. It's going to take like a few seconds just to say hi. And as you can see from the name of the company, it's been focusing on diabetes, which actually we know that it's an everyday decision-making disease, especially to those that use insulin to treat themselves. So what we're thinking is to integrate what we have as a doctors, according to the guidelines, to our mind, what we advise our patients every day, what we tell them when they call us on the phone, because they have to decide. They have to decide when they do insulin, they have to decide when they eat, they have to decide when they exercise, they have to decide even when they are stressing and thinking. So this is what we have done. We have created a platform that integrates all this information, that integrates the information that the patient enters in the application, and what the guidelines say about diabetes and what the clinical experience says. So it could take, I guess, more than a couple of hours to explain how it works, but basically this is what it does. And at the same time, it's been connected with a cloud platform that enables the physician to get in touch with the patient. And then actually there are tons of warnings, of notifications, of guidance from the application according to the data that are entered in the app. So this is pretty much it. And actually, this is how it looks like, different screens. We're working now on updating the look and feel of the application. And we have also this hypo alert here. I just want to mention about that. When somebody has hypoglycemia or prone to hypoglycemia and there is no carbs around and the patient may
the
faint.
time is off.
Okay.
The time is off.
You can. Okay, thank you very much. Why don't you shout me when the time is off?
It's just 2 minutes. It's fire pitching. Sorry. Yeah. So the next one is GiveMed and Elias Karelis. And please, Vagos Plerneas, get ready for the next one. Okay?
So, you may already know that more than 2,300,000 people in Greece live under the poverty line. This, of course, means that the majority of them cannot afford to buy their own medication. But what you might not know is that 14,000 kilos of medicines are annually thrown away in Greece before even their expiration date. My team and I decided to do something in order to bridge this gap. My name is Elias, and today we'll be introducing you to GiveMed. GiveMed is the first network for utilizing excess medicines in order to help people in need. Our goal is to, first of all, raise awareness about the problem, and secondly, collaborate with organizations that provide medicines to people in need, such as NGOs and social pharmacies, and connect them with excess medicines. In order to do so, we came up with an easy and effective solution which utilizes technology. Our main course of action is the development of our mobile apps for Android and iOS. By using this app, the user can register his medicines simply by photographing them, thus creating his own personal pharmacy. After that, the app automatically matches the medicine needs of the organization we collaborate with the registered medicines. Then, the user can opt to donate the medicine and can select whether he wants someone from our network to pick it up from his home or whether he wants to deliver to the organization by himself. In the future, we plan to extend the same functionality through our website in order to further broaden our audience. In the last 5 months, more than 400 users have registered to our applications, leading to registering more than 2,400 medicine boxes and leading to donations worth more than 10,000 euros. These medicines were, of course, given to the 15 organizations we work with, such as Praxis, Kivotos του Κόσμου, and many more. Our vision is for everybody to have direct access to the medicine they need. We hope that you will be our allies. Thank you for your time.
Impressive. Just under 2 minutes. Thank you. Vagos Plerneas has already got up. And Humane should prepare also.
Okay, great. So I'm Vangos Pternes. I'm going to talk to you about Kinetisence. Kinetisence is a real-time motion analysis software for healthcare professionals and personal trainers. Using Kinetisence, you can measure the range of motion of more than 20 human body joints, analyze the posture, analyze functional movement and balance. Currently, Kinetisence is being used by practitioners in the US, Canada, and Northern Europe. It's been given a grant by Canadian funds for $500,000, and it's currently expanding to more countries, reaching more and more people. Kinetisence customers, primarily doctors and trainers, are experiencing a 30% increase in their referrals and consecutively their revenue. If you want to experience the app in action, join us in Technopolis in a few hours. Thank you very much.
Thank you, Vagos. Thank you. Humane, Dimitris Kondopidis.
Hello from Humane also. I'm Dimitris Kontompidis, and in Humane we know that 50% of the population are people with chronic disease and disabilities. Also, we believe that people with disabilities have abilities, so we want to empower them. How do we do that? We are targeting to 3 tasks: awareness, healthcare support, and labor integration. We have designed reaction products. Actually, there are T-shirts, mugs, and notes. And every reaction is dedicated to a different disease. So, with this movement, we want to give lifestyle a social value. How do we do that? When you buy a reaction product, you support 3 values: think, care, and power. Think, because inside the box is an awareness leaflet that informs you about a different disease. Care. Inside the box there is a reaction card that supports a specific healthcare services. And third, empower, because we will hire people with disabilities to sell these products in our boutique. So everything of this you can see it real time in the website, in our mobile app. For example, in cystic fibrosis, that is a lung function disease, you can see that when we sell 90 products, we can support 4 physiotherapy sessions, and we can hire a person with cystic fibrosis for 6 days. That is Humane, and we are designing a humane world with your reaction. Thank you.
Thank you. Thank you, Dimitris. Dr. Anytime, Christos Managoudis. And Alex Sotiropoulos would prepare also for the next one.
Just give me a second, because it's a PDF. I actually learned the shortcut for this one. No, τα βελάκια. The next.
Okay, hello. So who do you turn to when you're sick? Who do you turn to when you seek advice? Most people would argue that this is a job for 3 persons: your mother, maybe a friend who had the same problem with you, and of course a doctor. For the past 4 years, Dr. Anytime has been their doctor for more than 4 million of users. Excuse me, both in Greece and Belgium. Dr. Anytime is the leading platform for online medical appointments in Greece. Every month we have 130,000 registered users that see 5,000 doctor profiles and see their services, see their expertise, search about their experience, see thousands of reviews from registered patients, and they book more than 9,000 appointments online every month. And we've gone beyond that. Dr. Anytime has developed a smart system to filter the needs of the patient so as to If they want to search about the services, they want to search about condition or a medical procedure. And they narrow down the search by a lot of time. Also, we have created an automatic electronic health consulting service called eSimbulos that is based on your needs, on your custom needs, according to your demographical criteria and also your medical history. And they can help you and suggest you what doctors you should visit and what medical procedure, yes, you should have. So, Doctor in Time is more than a booking service for doctor appointment. It is a living, breathing health companion for patients that believe that good health is a birthright for every person. And with Doctor in Times, you can be sure that you are in good hands. Thank you very much.
Thank you, Mr. Sotiropoulos. And Sorin Dragomiri should prepare also.
So it's blood, right? Bloody? Sorry.
Bloody, yeah.
I actually was calling it bloody, but somebody said it doesn't sound good. Sorry, get that there. There you go.
Here you are.
Good morning, everyone. I'm Alex, and I want to ask you something. Have you ever imagined being in a car crash? 15,000 people every year in Greece find themselves in this position, and those severely injured will need a blood transfusion within the next 24 hours. Meanwhile, only 0.65% of the population is being considered a regular blood donor. Every year we need 700,000 units of blood, and we cover less than 50% with our volunteers. 42% of the population is not donating blood at all because they don't know the problem or they're misinformed and afraid of the procedure. So that's where three university students came in and decided to redefine the perception of a blood donor as simply a responsible citizen. Bloody is a social enterprise that aims to raise the percentage of blood donors with its physical and digital presence. Our online platform is using its forces to help people in need find a blood donor with a fast and safe process. And our blog is hosting all the information needed in order to educate the first online active community of blood donors. We count more than 3,000 members in the past year of actions varying of blood donations in association with universities to educational events for the employees of big corporations. The past year we were able to achieve 1,800 blood transfusions by raising awareness among the young people. And that's why we're now producing our own educational board game, reaching our hands out to the young members of our society, looking into a future of a self-sustainable system. 1 in 3 people in this room and in our country will need a blood transfusion in their life. Our vision is that in the next years, nobody will need to care about finding blood. This is what we do, and we hope to let you know more about this soon.
Thank you.
Thank you very much.
Web Hippocrates, Sorin. And also Stavros Chizas should prepare for the next one.
So, I'll start with the video. You okay? Just give me a second. Get that ready there.
For some time, everything started going on.
Here we are. So just let it play from the beginning. We'll give you a half-minute more. We'll do an exception. You come all the way from Romania or the States?
Yes, I came from Romania. We are an international team, Romania, Greece, UK, US. And what is the best place in the world to present a platform called the Web Hippocrates? I guess that in Athens.
Just give me a second here.
We'll just put one question. How many times you or somebody close to you was hearing this question? I need a good doctor. And we need a good doctor when we are facing a surgery, because this is irreversible. We are working with radiology, pathology, so let the images speak for us.
Online, from shopping to banking. And now, even medical expertise. At some point in our lives, we will need a doctor to see us and get ourselves checked thoroughly. We're talking about blood analysis, MRI, X-rays, and so on. After all of these, the doctor will reach a conclusion, but our journey will not end there. From that point on, a whole circuit begins, because when it comes to health, we always ask for more than one opinion. Sometimes doctors have even different diagnostics, and of course we want to hear them all. But this process of going door to door isn't only difficult and time-consuming, it is also expensive. Now you have the opportunity to ask for advice from the best doctors anywhere in the world. By sitting in front of your laptop. Using our friendly interface is easy. You have to make an account on our platform, upload your medical images, all documents related, first diagnostic, medical history, current treatments, EHR, MRIs, CT, and PETC. Instantly, your selected doctors will be notified about a new patient in need. Your health is important to us, so you can get an accurate diagnostic in maximum 48 hours. We're dedicated to make you understand perfectly everything you need to know, so you can make a video conference with your doctor via our own teleconference solution. Everything is cloud-based, secure cloud-based, and your personal data is confidential. The security of your information is one of our top priorities. Data exchange and private information are encrypted and stored separately from the images. We use the best IT solutions, so our platform works at its best on Google Chrome. We believe that brilliant minds along with remarkable technology exist to serve your health.
Thank you.
Just in time. Yeah. So, Stavros Schizas, over. And then we have Christos Alexakos from Insibio.
Okay, so right so over. Να κάτσε λίγο να γυρίσουμε. Apologies for that. There it is. Hopefully. I decided to take it on this side again. So here we go. Με το δεξί.
Hello, I'm Stavros, CTO at Mobiltron. The worst call a parent can get is that the children is injured in the hospital falling after some accident. As we don't want this to happen to you, we developed Wover, a system that monitors your child's environment via smartphone and wearables, so it can predict and let you know if something went seriously wrong. Actually, for everyone you care about, your parents, your friends, your spouse, your children, it will let you know if there is any emergency that needs to be addressed. In the event of emergency, such as crashing while driving, Wover notifies your network with vital information regarding your location, medical condition, and activities. Using artificial intelligence algorithms, Wover trained itself to yourself so it can detect potential emergency situations. It warns you about them so you can prevent them from happening. Our solution has patent-pending technology, and currently we are having a private beta in the process with very promising initial results. Our team has expertise in software development, data science, and startups. So, in the current phase, we are looking to close the pre-seed round to complete the beta version, file the remaining patents, and continue our conversations for informal pilot with insurance companies. Thank you very much.
So, Christos Alexakos from Insibio and Katerina Xakoustidou should prepare for the next one.
Okay, hello. I'm Christos Alexakos, CEO of Insibio. Intelligent System Biology is a bioinformatics company focused on early-stage biomarker discovery. Modern approaches in personalized medicine suggest narrowing down biomarkers, candidate biomarkers, that lead to the design of new medicine, nutrition, even cosmetic products. In Sybios main product, in Sybios Suite, it's stuck.
Yeah, just keep on going.
Okay. Sorry. Okay. In Sybios Suite is a cloud platform. Okay. Need a lot of time. Okay, so it is a cloud platform, a suite of software tools that analyze biological data with intelligent algorithms. It is an all-inclusive solution for biomarker discovery. Half a minute, please. Biomarker discovery, and is provided in 3 and 12-month licenses. In Sybios, it is not like classical biomarker discovery software. It sees the organism as a complex system with structural components that are tightly adaptable. Our technology has been validated with joint research projects with academic institutions in Greece and US, as you see. And last but not least, you will see that Nestlé is using our technology in order to locate peptides, proteins, and spectra that are used as biomarkers for selecting the best personalized diet using their nutrition products, and also they can forecast the outcome of a specific diet with significant accuracy. In Sybios participates in NBG SEEDS programs, and thank you very much. Sorry for the delay.
Thank you, Christo. Thank you very much. So, Katarina Exakoustidou from Vita Broad, and Nikos Naoum should prepare also.
Teeth are necessary. We need them to eat, to have a nice conversation, to smile. We need them to enjoy life. Teeth infections, however, can cause dental problems, which can lead to heart diseases. But guess what? 41% of dental patients concerns about getting dental treatments because they are not covered by insurance companies and the costs are really high in the home countries. Vita Broad introduces an online booking application which offers patients worldwide safe and affordable dental treatments in Greece. The process is simple. The users choose a dentist and a treatment, book an appointment, use the rating system, pay, and have access to other services as well. We are proud because our application combines technical innovation and quality. Our network is armed with European and American board certified physicians who have studied and worked both in Europe and the USA. With our solution, we don't only help patients from all over the world have access to safe and affordable dental treatments in Greece, but we also help Greek economy benefit from the mass of medical tourists in our country and the steady development of the industry. Our solution is part of a master plan, health tourism in Greece. We plan to expand to aesthetic treatments the second year and to other treatments the years after. Our elite team of dentists, developers, and business people is committed to one goal: deliver the best medical tourism experience to patients worldwide. I'm Katerina, co-founder of Vita Broad, and I invite you all to support our mission to give the world the smile it deserves. Thank you.
Thank you, Katerina. Thank you. Nikos Naoum from Blue Line, and Andreas Menichtes should also prepare from BioAssist.
Hello, my name is Nikos Naum, and I'm from Blue Line. So the problem we are solving in the primary healthcare provision in megacities. Such services are provided in notoriously inefficient ways, leaving most of the customers unsatisfied and creating a notoriously high cost burden to the national healthcare system. So the Blue Line is the real-time on-demand matchmaking platform which connects patients and with doctors. In other words, we call it an Uber for doctors, or the Greek version Taxibit for doctors. It's a mobile application right now. You just log into the system and select the doctor of your choice based on several criteria like cost, location, insurance coverage, and reviews. The doctor of your choice will be at your door within 2 hours. So our team is very solid and multidisciplinary team. We combine medical, technical, and business skills. So this is Blue Line. Thank you very much for your attention.
Andreas Menigtas is next.
I think that's the first time we heard somebody compared to a Greek startup and not Uber for something.
Uber, yes.
Taxibit, that was nice.
That's it. Yes, he gave the Greek equivalent.
So,
and Vangelis Dermatas should also prepare.
Just take that there.
Hello, my name is Andreas Menigtas and I represent BioAssist. I represent BioAssist, a new Greek startup aiming to reinvent assistive care. Our team has a strong scientific background in the area of ICT and healthcare, and we focus on the creation of a holistic, robust, yet user-friendly mobile health service for elderly people and patients with chronic diseases. We aim to help these people live independently and improve their quality of life. BioAssist proposes an innovative healthcare, home care and assisted living solution, namely Πάντα Μαζί, which integrates a rich set of state-of-the-art technologies such as wearables, biosensors, Internet of Things, and machine learning, and our goal is to improve the safety of the users at home, avoid unnecessary hospitalizations by monitoring their biosignals, and allowing them to communicate effectively with their doctors and families. In the process of designing the system, we take into consideration the requirements of our users. So we created a system that is highly usable from the end users, and most importantly, it has minimum interference with their users, their habits and lifestyle. It is also cost-effective, so it can be widely adopted and deployed by the users and families. It includes a rich set of features, and among others, it provides communication with their doctors and relatives, a remote monitoring of biosignals and activities, and it also provides 24/7 support in emergencies. And yes, you can see us at Technopolis for a live demo. Thank you.
Thank you, Andrea. Thank you. So, Keresno, Vangelis Dermatas, and Dimitris Gavrilis should also prepare.
Sorry. Okay, thank you.
Good morning. My name is Vangelis Dermatas, and I'll present a device called Karesno, which is initially designed for doctors who want to monitoring the cardiac respiration and snoring phenomena during sleeping in sleeping persons. After years of development, several improvements has been achieved, and the most important advantages over similar approaches is the non-contact capabilities of the system, because an array of sensors are positioned under the bed sheets, and the sleeping person can be move freely during sleeping time. And the second advantage is that the systems can acquire the desired signals at all times. We don't have dead times. I mean periods that the system cannot have information about these physiological measurements. In the figure, you can see the respiration rate, which is the longer amplitude transitions. In the dark area, we have an apnea, which is about 20 seconds. And in this area, you can see clearly the cardiac signal. This is the result of advanced signal processing methods, which eliminates noise and other interference. And here we have also another hypopnea phenomena. There are a great number of applications, and shortly I mention the most important, which is that device can be used in intensive care rooms for adults and newborns, and you can see the others.
Thank you. Thank you, Mr. Dermatas. Dimitris Gavrilis and Claude Emma.
I imagine in the sudden death infant syndrome, that must be quite important. So, Dimitris, Claude Emma. Come on. What? Doesn't want to open. Yep.
Good morning, everyone. I'm Dimitris Gavrilis. I'm presenting our cloud electronic medical assistant. So the challenges in creating an EMA mostly has to do with medical examination monitoring. And usually what we have to deal with is the cost, the accuracy of the exam reporting, the time it takes to do the reporting, the errors that the doctors are generating during that reporting, of course, an intuitive UI, and finally the flexibility a system like this should have. The current market, the global market in EHR, it was $15.56 billion in 2013, and expected to rise to 23.98 billion by 2020. That's about 6.5 in compound annual growth rate. So our solution, Cloudema, involves a cloud-based infrastructure provided as a service that uses multiple taxonomies and ontologies in order to allow doctors to perform the reporting using structured information. It involves customizable clinical examination plans, a minimalistic, intuitive user interface, completely different than the traditional approaches, a machine learning-based integrated recommendation engine, and a reasoning-based alerting mechanism. Finally, our API is capable of integrating the various medical sensors and devices. You can find more information here at our website, and we are currently in private beta. In the upcoming few months, we're hoping to have our first release candidate. And here's our core team. Thank you.
Thank you. Well, we know Anni Pakarinen, who comes from distant Finland. And next should be Thanos Stavropoulos.
Okay.
Kalimera. Oh, this is the...
Press the play up there. Look there on your right. Here, you gotta sort of turn your head. Oh, come on, what happened now?
It was in the
Don't worry.
second page, I think.
Now you just use the arrows. Once it plays. So, for some reason it just keeps on going. I'm sure you can say everything.
Okay. Child's well-being depends on the well-being of their families. Elements for family well-being stems from their health behaviors like physical activity, nutrition, and their everyday life. Fourth element, family resources, define how families handle their everyday life and cope with challenges. If one of these elements breaks down, it endangers the well-being of the child. How do we detect those broken elements to support family well-being? I am Anni Pakarinen, health scientist from University of Turku, Finland. We have developed Wellwe app, a tool to solve this problem. It was developed based on scientific evidence in a multidisciplinary group. With Wellwe, families assess together elements for family well-being, which facilitates the conversation and interaction between family members. The visualization of Wellwe helps them to realize needs for change and attracts children, fostering their own role as health promotive actor more than previous methods. This is going so fast. Okay, yeah. Wellwe may be used in health, social, and educational services to assess and promote family well-being. The visualization and statistical elements for professionals eases detecting each family's individual needs to keep more tailored and family-centered counseling. We have piloted Wellwe in health services in Finland and are currently testing it in Germany in social services. So this tool is modifiable and may be used in several settings to promote family well-being. Ευχαριστώ.
Thank you, Annie. So now we have Thanos Stavropoulos from Keralia, and Konstantinos Poulas should prepare for the next one, next speech.
Όχι, αναγκαστικά θα βρεθεί στην οθόνη. Μπορείς να κοιτάς, να γερνάς.
Okay, hi everyone. So we all know the increasing population with dementia in the next, coming years. It's going to be 2 trillion worldwide for care very soon, in a few decades. So what many people don't know is that there is no drug currently for Alzheimer's and other types of dementia. The only treatment is non-pharmaceutical interventions, which like brain games and exercise, taking walks regularly every day. These unfortunately are driven by nurses, which have to monitor people and put down notes and everything. So this is very costly and error-prone. Until Kerelia, the system that brings intelligent care and intelligent sensing into people's homes, clinics, and also nursing homes. The system builds around 4 pillars of innovation, so it's interconnected with retail wearables from the market, so it's also personalized for people to buy whatever hardware they need. This works as plugins and provide vitals and raw sensor data, which is then further interpreted into the system and transformed into more meaningful information like symptoms and behavioral patterns like stress and daily activities. These are all present, of course, in tailored applications to the doctors, so they can see the patterns in time and intervene timely. Another innovation is the clinical validation done already in EU-funded research all over Europe, in Ireland, Sweden, France, and Greece. We are heavy on research, and we have also managed to achieve the Hellenic Entrepreneurship Award this year in the top 10. And we are a spin-off of the CERT. And if you want to find out more about us for our vision caring for dementia, you can find us in Technopolis. Thank you very much.
Thank you. Thank you, Thanos. Mr. Poulas? sports electroceuticals. From the not too distant Patras.
So, good morning. I am Konstantinos Poulas. I'm coming from Patras, and I am here to present a new technological idea, which is electroceuticals. Electroceuticals is a neologism that refers to the use of electrical stimulation, and an example is on the left, or electromagnetic fields in order to improve the health and well-being. In the case of sports, we can offer fast recovery from injuries and any other kind of wounds, either by using only the microcurrents or by using electromagnetic fields. And as you can see, we have collaborated with one of the biggest European football teams, Athens, and we have seen that sports electroceuticals is a proven electroceutical solution. It is a certified technology. It is patented, innovative, and we can deliver fast treatment, and we can have at least 20 to 25 accelerated healing for many sports cases. In general, it reduces pain. It can recover the patients from any kind of muscle or even bone fractures. And we are an international team, as you can see. Oh, sorry. So we are from Denmark, from Hong Kong, from Greece. Our idea is presented in some conferences, and we have been among the top 50 athletic innovative ideas. And the presentation, and I finish, is dedicated to John, who passed away a week ago, and also to my ex-student Ariadne, who is here, and also my new students who are in the audience. So thank you very much.
Thank you. Now we have Elena Barla from Among Doctors platform. And also, Yannis Valavanis should prepare for the next one.
Good morning, everyone. Medicine is a team sport. No single doctor knows everything. Having a trusted peers network significantly improves access to scientific knowledge, clinical guidance, and career development opportunities. Doctors seek an opinion from a colleague they can trust. The way networking is done has changed over the years. The doctors have moved gradually from initially a limited personal network towards yearly medical conferences and costly forums, and then later on to open social media in order to get in touch with the medical community and share opportunities and knowledge from their practices. These current solutions, though, have a gap. And the gap is that the doctors, they are afraid that they might be risking their reputation or they might be losing time filtering through relevant to the needs information. For this reason, we're entering an era of specialized social networks. Enter Among Doctors. My team and I have developed a global online, a global online platform exclusive and only for licensed physicians that helps them connect with reliable colleagues all over the globe. So the doctors have the chance to join an exclusive elite community with well-screened doctors from all specialties across countries, increase their global referral base and professional network, exchange opinions and second colleague opinions in difficult cases, form trusted working groups with colleagues, and also showcase their work and increase their reputation. For more information, please visit amongdoctors.com. Thank you very much.
Thank you, Elena. Thank you very much. Yannis Valavanis now from eNeos. And also Alex Itzios from Healthy Club should prepare for the next one.
Good morning. Thank you. I'm Ioannis Valavanis, and I'm one of the co-founders of ENIOS. Our company, based here in Kalithea, Athens, is active in intelligent genomic data interpretation and gene target prioritization. We have emerged as a spin-off company from the National Hellenic Research Foundation about 3 years ago. Our methods and service include bioinforminer.com as a core and can be used from our customers in order to accelerate the development of novel biotechnological or pharmaceutical compounds or build new diagnostic or therapeutic services. In more detail, using our automated platform, our users can reveal the most important molecular mechanisms beneath a phenotype studied, and actually they can be delivered back in a precise and sophisticated manner the exact list of gene targets and related drugs to be further examined. Here are some screenshots from our platform and smart visualizations. We are up to now 8 people, 4 of which with a PhD. We have already succeeded recently, a second round investment from local investors, and we are targeting to actually penetrate the biological data interpretation market, currently estimated to be $1 billion worldwide and increasing annually by a 20% rate. As you can see, we have already had some revenues from certain revenue stream, and this makes us optimistic for our future growth and our penetration in this emerging and exciting market. Thank you very much.
Thank you. Thank you, Yanni. So we have Alex Itzios for a Healthy Club now, and Vasilis Alapatas should prepare for the next pitch.
Hi everyone, I'm Alex Itzios, I'm the team manager of Healthy Club, and we're making the lives of healthcare and wellness professionals a lot easier. Every time a personal trainer or a registered dietitian comes in contact with a client, he has to take into account various factors such as body metrics, type of foods that he likes, allergies, ailments, and his way of life. Of course, his problems don't stop there, as he has to manage and promote his business at the same time. As we can imagine, his plans lack precision and variety. With Healthy Club, we give the opportunity to healthcare and wellness professionals to make laser-targeted meal plans within 5 minutes. We manage their appointments automatically. We give them the ability to promote themselves throughout our marketing tools, and we give them the ability to monitor and track their clients' progress and update them automatically. With Healthy Club, we give the ability to sponsor and healthcare professionals to deliver the results their customers demand, and we help them increase their profits. Our goal is to revolutionize the way nutrition is approached by healthcare and wellness professionals and make people healthier. Thank you.
Thank you, Alex. Thank you. So, science for you, Vasilis Alapatas is next. Please, Vasilis.
Many thanks to the organizers for their hard work.
Thank you very much.
My name is Vasilis Alapatas, and I represent Sci-Fi, Science for You. Sci-Fi is a not-for-profit organization that develops information technology systems to solve real-life problems. The results... Τι έγινε, παιδιά? Δεν πειράζει, παίζει συνέχεια. Okay. The results of our work is available to everyone for free as open source. A large area of our interest, among others, is the assistive technologies for disabilities. Today I tell you a few words about a project that has just completed. Talk and Play, funded by Stavros Niarchos Foundation. Aimed at people with mobility impairments with parallel problem, serious problem of dysarthria. That means, in other words, they hardly are able to move and they cannot speak. Cerebral palsy is a typical example. Sometimes we have additional mental disability problems. These people need to communicate, I'm thirsty, to have a little bit fun, listening to music, for example, or to train for their rehabilitation. Talk and Play meets these needs. It's a free open source software that can be controlled by a single button. Useful for impaired persons, for their family, the carers, occupational therapists, or any organization that deals with this vulnerable group.
Thank you, Vasily.
Thank you a
More,
lot.
more at the exhibition. Thank you very much. Yes. Now we have Zoe Kournia from Ingridio. Please.
Thanks, Yanni. I would like to ask the audience, do you know what is contained in the food that you eat and whether it has toxic ingredients? We know that millions of people get intestine cancer because of food ingredients, but the average consumer doesn't know about this. Also, millions get food allergies, but only 10% of cosmetics ingredients are tested for safety. I am a chemist, and I don't even know what kind of ingredients do I use, because when I try to read the label, it's complicated even for me. We want to change that. We believe that we can maintain a healthy lifestyle if we know what we eat and if we know what we put on our skin. We believe that proactive care can be achieved if we monitor the ingredients that are contained in our food. So we have developed a mobile phone application that offers fast and easy identification of ingredient toxicity in food and cosmetics, simply by taking a picture of the label of the ingredients, then converting the image into text, then searching through our chemical database and informing consumer about toxicity. In this way, you have a chemical lab in your pocket. We are going to inform consumers about our application through festivals and marketing through social media, of course, our landing page and campaigns. Our consumers, our customers are consumers and businesses, and we maintain the sustainability of the app, which is free, through in-app purchases and personalized databases of the users where they can store their history. So we invite everyone to our stand in the Startup Garden in Gazi to know more about our app. We can show you how it works. And we hope that you will enjoy it and hope that we will create a better future in a world free of toxic chemicals. Thank you very much.
Thank you, Zoe. Thank you. So, Vicky, now we have a video.
We have one video because he cannot be here from Care Across.
Care Across is the company.
Second. not getting good at this. Sorry for that. There it goes.
Cancer has a huge impact, with about 32 million people living with the disease worldwide. Despite this, there is very little data being collected about cancer, and even less is actually being used. We see a huge gap there because such data could help improve patients' lives or even actually save them. We're not alone in seeing this gap. The healthcare analytics industry is growing fast and is expected to reach $21 billion in value by 2020. There's another gap: clinical trial recruitment. Pharmaceutical companies are struggling to find patients for their clinical trials, and every day a drug's trial is delayed, they lose $8 million. It's clear that the industry needs this data to expedite research and to offer patients better ways to manage their disease. It's also clear that patients need all the information and support they can get. And these are what we provide through Care Across.
Treating patients with cancer is a great challenge. We need well-informed patients, fully aware of all details about their disease. Today, we can combine oncology science with technology. A strong group of top oncologists around the world, our scientific committee, is a source for reliable cancer information that can empower our patients and strengthen their psychology.